All right, today I'm joined by Dr. Kaushal Kulkarni, who's the founder of Eyetamins. Welcome.
Thank you, Scott.
All right, so you go by Dr. K, and you specialize in the field of eye-brain relationship. Tell us a little bit more, because I know many of us are familiar with ophthalmologists, but neuro-ophthalmologists, that's intriguing. So tell us about your field.
Yeah, it's really a niche. So once you go into ophthalmology or eye surgery, there are actually 7 different subspecialties within that. And neuro-ophthalmology is one of them. There's very few people in the world that do it because it's kind of a complex field. It's not really so surgical based. And you really deal with neurological disorders that affect your vision. So people don't know this, but 50% of your brain is actually devoted towards vision and eye movements. It's a huge chunk of it. And there's many, many things that can go wrong, including double vision, MS, brain tumors, strokes. So if you got to see me, it's usually not a good thing.
So aside from some of the terminal and acute issues, things like maybe migraine or maybe a small seizure as an example that could have some implication to the eyes or vision, all of those will fall within your field. Is that right?
Yeah, absolutely. Any neurological disorder that affects your vision or your eye movements as well.
hmm Now, is it the other way around in the sense you have some sort of vision issues that affects the brain, or generally it's a neuro or brain types of a disease that affects the vision?
Yeah, good question. So technically, the eye itself is actually part of the brain. It's actually the most forward part of the brain. So the optic nerve is actually the connection between the eyeball and the brain. So you can definitely have optic nerve issues that then are related to the brain issues.
Mhm.
It's all intimately connected.
Yeah, that's a great point. So, which brings up to the topic that we're going to be discussing today, is that vitamins, which was a very nice play on word around vitamins for eyes, is really trying to address something that's really fairly pervasive, not just here in the States, but across the world. So tell us about some of the kind of behavioral things around mobile devices, the duration, and how that's affecting the strain on our eyes and even the quality of our sleep.
Yeah, absolutely. I mean, as you know, everyone's on the phone or computer or laptop for 8 to 10 hours a day now. The statistics are just out of control. Teenagers are on the screen for 10 hours a day. So, I generally say that our eyes were not designed to function this way, and we're putting a lot of strain on our eyes. The jury's still out in terms of the research, in terms of how it affects macular degeneration and other degenerative eye diseases. But certainly we're seeing a lot of eye strain, just people saying their eyes feel tired, dry, fatigued towards the end of the day. People can't read as much as they want to. So it's affecting the whole population, and it's a huge problem that's coming up.
So I know you're treating it more from a kind of a nourishment or more from a symptomatic way to treat it, but what are some behavioral changes or things that we can change in terms of, again, small changes to our lifestyle that could help with some of the straining?
Yeah, absolutely. So there's a couple things I tell everybody. First, it's the common sense knowledge that everyone tells you: take a break from the screen, look up after every 20 minutes or so. But to be honest, Scott, I mean, I don't do that. No one really thinks about doing that. It's really not till your eyes get really strained or tired that you do it. Other things that I like to do are put these filtering apps on my phone or screen. So Flux and Night Shift are 2 of the popular ones on the Apple devices. And that it doesn't block the blue light that comes out, but it does help to reduce the strain on your eyes. And of course, the other thing is, wearing blue blocking glasses. Those have become really popular nowadays. I still wear them at nighttime. Those are good. The only problem is the research so far that's come out shows that they're not very effective in terms of prevention or improving your sleep. And then, of course, just staying healthy, getting sunshine every day is good. You don't want to be glued to artificial light every day. Sunshine is really good for setting your circadian rhythm and helping with your overall health.
All right, so you mentioned blue light. I think many of us have some level of understanding, but maybe not at the level that you're talking about. Why is that spectrum and the kind of light that emits from electronic devices, including laptops, such an issue?
So for this, you have to go back to, remember, like elementary school physics or science. So there's this spectrum of light called the visible light spectrum, and it goes by the acronym Roy G. Biv. So red, orange, yellow, green, blue, indigo, violet. And so that blue, indigo, violet part is actually closest, it sits right next to UV light on the broader electromagnetic spectrum. Now, all of us know that UV light can be damaging for your skin and your health and your eyes. Blue light sits right near that, so although it's not as strong as UV light, it comes close to it.
Mhm.
And where that ties in with the computer is that the wavelength of light they use to light up these screens and the LEDs is actually close to the blue end of the spectrum because it's high energy and it's short wavelength. So there's some thought that if you're exposed to too much of this blue high energy light, it can cause oxidative damage in the retina. And so that's what we're really talking about when we say blue light.
Now, you did mention that some of those studies are still somewhat inconclusive, or is there enough empirical evidence to indicate that that could be a pretty significant issue?
We're somewhere in between. So in animal studies and when you take retinal cells out of the body and you study them, you expose them to blue light, it does cause a lot of damage. It causes something called apoptosis, which is when a cell has programmed cell death due to an injury or exposure. And the mitochondria also get affected. It's too early for us to have long-term human studies. And as a physician, physicians tend to be very cautious in their claims. So I can't come out and say there's this study on humans that shows that it affects you. But if you extrapolate the data from animals and from looking at the cells, there's definitely a potential for damage.
All right, so we talked about some of the cause and as well as our behavior. What you're addressing is really more on the supplement side. So tell us a little bit more about eye vitamins, specifically this product called Blue Blocker.
Yeah, absolutely. So as an ophthalmologist, I started looking into this issue because it's affecting so many of my patients and so many of my friends and family. So I looked at the solutions out there, like what are the best solutions to preventing damage from blue light and also eye strain. And the most common solutions besides the ones I talked about were the blue blocking glasses. But when I looked at the research and really looked at the analysis, they were no better than plain clear lenses. And there's actually a ton of research on these eye vitamins. We actually have studies over 20 years and over 80 clinical studies on vitamins like lutein and zeaxanthin. And the reason is, in the ophthalmology world, we were using these to treat macular degeneration. And we just have so much data on them, so much safety data. And without going into too much of the specifics, those compounds are specifically blue light filters. Because of the chemistry of them, they get taken up into the retina, and then they basically absorb any high energy effects of the blue light. And we can go into the properties and why that is, but there's just a lot of research showing that these are the best ways to prevent blue light damage and just nourish your eyes from the inside out. I usually talk about the glasses as like a Band-Aid over your eyes, whereas the vitamins are getting into the inside and actually getting down to the root of the problem.
And these compounds that has an incredible amount of research behind it, is it at a point where the patents have expired, or do you have to license it?
Yeah, very good question. There's a huge patent story about these, and right now there's a couple of different patents that are out there. So for macular degeneration, there's a patent that is going to expire in 2023, and so we're looking at that. And then in terms of blue light, the patent is quite complicated, and I spent a lot of time with a very good patent lawyer to sort it out. But there are ways you can use a different type of one of the compounds called zeaxanthin, which actually has two isomers. There's zeaxanthin and mesozeaxanthin. And the patent is around the regular zeaxanthin, but the one we use is mesozeaxanthin. So that's a long story short how you get around the patent.
Great. That's terrific. Now, based on what you've seen in terms of your consumers of these supplements, do they have to get to a certain, let's say, deterioration or certain, fatigue or a strain before they say, well, I need to look for some ways to mitigate this? Or is it something that you recommend as a supplement to just start as a way to slow down the strain, or just as an early mitigation?
Yeah, I would say both. I do think they can benefit everybody. And if you look at the data, it really increases the strength of the pigment in your macula, which can even enhance your vision and give you extra contrast sensitivity, better night vision, and so forth. But to your first question, do they need to experience the strain? Not really, but as you know, in the consumer world, unless somebody feels that problem and feels the pain of that problem, they're not really going to seek us out. I might show them the product and it's not going to resonate with them if it doesn't touch that problem they're having.
Yeah, that's a great point. Which brings me to the second product you have, which is called Optimize. Tell us about that and how is that different?
So Optimize was designed as kind of a next level for people that not only want to protect their vision, but also enhance their vision and also their cognition and memory. So the idea behind Optimize is to have a vision protecting and enhancing supplement along with a mental and cognitive enhancement. And because I focus on the eye-brain relationship, I wanted to bring out a product that could affect both and improve both. So what makes Optimize different is it contains something called a nootropic, actually two different nootropics in it. And those are used widely in the supplement world for strength enhancement, memory enhancement, mood enhancement, and just improved cognition overall. So we're marketing it more towards people that have maybe declining memory, maybe early dementia, people that have had strokes. There's some evidence that it can help those people. Another big market, though, is like the gaming and performance market.
Mm-hmm.
There are a lot of gamers out there that could benefit from Optimize because it just improves your performance and gives you some protection from those, 8 to 10 hours they're on a screen every day.
Very interesting. And then you guys are working on another product that you guys haven't officially named, and I guess it's really focusing on the dry eye side. Well, can you tell us more about that?
Yeah, absolutely. I'm really excited for this product. So dry eye is a huge problem in the US. There's over 20 million people. And in my practice, I saw that there are not very many good solutions for people that have moderate to severe dry eye. And dry eye is, again, when you have foreign body sensation, your eyes feel tired, scratchy, blurry, itchy. In the ophthalmology world, there's a lot of evidence that omega-3 supplements can improve dry eye. And we've done many, many studies. There was actually a huge trial that they did recently, which didn't really pan out. It wasn't clear whether that had any benefit. But because I have a background in kind of meditation and I've been really connected with the Tibetan world, there are some Tibetan ingredients that actually have omega-3, 6, 7, and 9. And I came across these just very fortuitously. And there was a study that shows that they can help with dry eye. So I'm really excited about bringing those natural, organic ingredients from the highest civilization in the world, in terms of altitude, where they're really like tested, and bringing those to the U.S. market for dry eye.
Are you in a position to elaborate in terms of what are these? Are these plants, berries? What exactly are they?
Yeah, I can't say too much because we're working on the patent now, but it's a berry. It's a type of berry that actually grows in high altitude in the Himalayas, and it's not a secret. It's being used all over the world for skin, for nourishment, for beauty, and for health, but hasn't really been used for dry eye. So we're hoping to make that happen.
So for those that, typically when they think about eye treatment, they're thinking in terms of eye drops. Here, we're really trying to nourish from inside out. Tell us about kind of that philosophy. And for those that are really looking for more topical treatments, what would be your response to them?
Yeah, topical treatments are good, especially for dry eye. I mean, almost everyone that has dry eye uses artificial teardrops. Again, it's kind of like applying a Band-Aid to the eye. It works when you put it in. People don't really like putting eye drops in, and it's very temporary. Whereas these really go into the bloodstream and then get taken up within the eye or the retina. And the best example is just nourishing it from the inside out, where it's more like in your bloodstream and it's not just a temporary solution.
Okay. And just as a obvious disclaimer for everyone, of course, is these are supplements. These are not pharmaceutical products. For those that are kind of sitting on the fence in terms of, the benefit sounds very promising, but either maybe they're not at that level of kind of chronic, illness in terms of some of the issues, or they feel like, is this kind of worth it? What would be your response or your advice?
Yeah, I mean, I think number one, of course, is try it. We've had great reviews so far, so everyone that has tried the product has noticed a difference in their eyes. And we're offering a lot of different promotions and trials for people that want to try it. But the other thing is, I see this all the time in the medical field is, people don't really seek healthcare until it's a little bit too late, until you're like having a problem. And I always say prevention is better than cure. So, we know that being on the screen all the time is going to dry your eyes out, cause eye strain. Even though you may not feel, really compelled right now to do something about it, it's really for somebody that can think long term and is more preventative rather than just seeking an immediate solution after they have a problem.
Well, I think one thing that is very compelling is that when people do have red eyes, and red eyes, again, I think it has a medical terminology, but people that have kind of redness in their eyes and they're constantly putting drops, and of course these drops typically are not preservative free, and they have tons of other chemicals that's in there that's not really beneficial. For those people, including myself, it becomes more of a cosmetic issue, and the level of urgency or importance actually rise. For those type of people with issues around red eyes or redness, I should say, which product do you recommend as a supplement?
It's definitely going to be the dry eye product. So for people that have the red eyes and dry eyes, or just from working all day, and if you're already using eye drops for that, then I think the dry eye product can really help. There's many causes of red eye. If you look in the textbooks, there's like hundreds of them. So I'd really have to see make sure there's basically no infection or allergy or other thing going on. But if it's just from overuse and dry eyes, I'm really excited to have people try the dry eye product for that.
All right, great. So with that, how can people learn more about Eyetamins?
Eyetamins.co is our website. EYETA, M as in Mary, I, N as in Nancy, S.co.
All right. So today I've been joined by Dr. K, who is the founder of Eyetamins. Thank you for joining today.
Thanks, Scott. Thanks for having me.